technology.
Good afternoon. My name is Andrea Goche. I'm here to talk about Huntington's disease. This disease affects 1 in every 30,000 people. It is a death sentence as there is no cure. It is named for Dr. George Huntington, who first discovered it in 1872. I will leave you with some statistics, but more importantly, I will leave you with how it affects its victims. My own family has been touched by this disease, and I've done extensive research on the topic. It is an autosomal dominant disease that attacks its victims and relentlessly until it takes their own life. I will now tell you about this disease known as Huntington's disease. This disorder is passed down through families. It affects the cells in the basal ganglia of the brain. This part of the brain affects movement, emotion, and cognitive ability. It affects the person's ability to talk, think, and move. It is autosomal dominant, meaning only one parent has to carry the gene to pass it on to their offspring. If you inherit the faulty gene, you are going to get the disease. There's no doubt about it. A child born to a parent with the gene has a 50% chance of inheriting the gene and getting the disease. I will now tell you about 2 types and the causes of HD, known as Huntington's disease. There are 2 forms. The most common is the adult onset type. Symptoms begin in the mid-30s to 40s. The second most common is the childhood or adolescent type. This is early onset, and it accounts for only a small number of cases, approximately 5 to 10%. Some of the causes of HD. The cause of HD is a genetic defect on the chromosome 4. It's caused by a gene mutation. The coding in this region is the DNA sequence CAG, or CAG for short. This triplet is repeated time and time again, and it varies from person to person. A normal person, it is repeated 10 to 26 times. In a person with HD, it is repeated more and more, approximately 40 times. This leaves clumps of protein in the brain that result in cell death. Most persons who die from the disease show a 25% loss of brain cells when they do die. Some of the symptoms and complications of HD mimic other illnesses such as Parkinson's disease. Behavior problems typically show up before movement problems. Some of the behavior issues that show up are irritability, moodiness, paranoia, psychosis, and restlessness. Some of the abnormal movements are facial movements, head turning to shift eye position, unsteady gait, and uncontrolled movements. Additional symptoms that occur and symptoms that occur in childhood are rigidity, tremors, and slow movements. Dementia gets worse. Dementia gets worse and results in disorientation, confusion, loss of judgment, loss of memory, and speech changes. Some of the complications that result from HD are an inability to care for self, cannot interact with others, injury to self or others, increased risk for infection, depression, and death. Now, genetic testing, prevention, and treatment of HD. Your doctor should perform a complete neurological exam along with diagnostic tests. Neurologically, he should look for dementia, abnormal movements, reflexes, prancing or wide gait, and hesitant speech or poor enunciation. Diagnostically, a head CT should be performed to look for loss of brain tissue, especially deep within the brain. An MRI of the brain and a PET scan of the brain can also be done. There is genetic testing that can let one know if you are a carrier of the gene. There is no prevention. Only genetic counseling is recommended to people with a family history of Huntington's disease. There is no cure, and there is no way to stop the progression of Huntington's disease. The goal is to slow down the symptoms and to allow the individual to function for as long and comfortably as possible. There are medications available. Dopamine blockers, amantadine and tetrabenzene decrease abnormal behaviors and control movements. Coenzyme Q10 has also been shown to slow the progression of the disease. Psychological symptoms also need to be treated as well. Depression and suicide are very common, and antidepressants need to be used as needed. Speech therapy is also available for speech impediments and impairments. Having said this, what's the prognosis for someone with HD? HD is an incurable, deadly disease that gets progressively worse over time. It is an autosomal dominant disease, which means only one parent has to pass it on, to carry it to pass it on to their children. It's a vicious disease that claims men and women alike. Most patients die within 15 to 20 years after diagnosis. Infection is one of the most common causes of death. Suicide is also common. My family has been touched by this disease. My great-grandmother was claimed, 3 of her children and 2 of her grandchildren were claimed from this disease. My father, fortunately, is free from the disease, and therefore so am I. Thank you.